Is there a link between immunosuppressants and cancer risk in lupus? Let's dive into an important question about lupus and the medications used to manage it. Systemic lupus erythematosus, commonly known as lupus, is a chronic autoimmune disease. It causes the immune system to attack healthy tissues, leading to inflammation and damage in various organs. To manage this, doctors often prescribe immunosuppressants. These medications help control the overactive immune response, but there are concerns about whether they might increase cancer risk. First, it's essential to understand how immunosuppressants work. They lower immune system activity, which can prevent tissue damage caused by lupus. However, this suppression can also affect the body's ability to detect and eliminate cancer cells. This raises the question of whether these medications contribute to a higher risk of developing certain cancers. Research indicates that lupus patients already have a slightly increased risk of some cancers, like non-Hodgkin lymphoma. This increased risk is thought to be linked to chronic inflammation and immune system stimulation caused by lupus itself. This baseline risk complicates the assessment of whether immunosuppressants further increase cancer risk. Different immunosuppressants carry varying levels of risk. Cyclophosphamide, for instance, is often used for severe cases of lupus and has been associated with a higher risk of bladder cancer and other malignancies due to its effects on DNA. Other medications like azathioprine and mycophenolate mofetil are also used but are considered to have a lower risk of cancer, although prolonged use can still pose some risk. Newer treatments, such as biologic agents and targeted therapies, are being developed. While these may offer new hope for lupus patients, their long-term cancer risk is still being studied. The mechanisms linking immunosuppression to cancer include reduced immune surveillance, which is the body's natural way of identifying and destroying emerging cancer cells. When considering these medications, it's crucial to balance the benefits against the risks. Immunosuppressants are vital for controlling lupus and preventing serious organ damage. Regular monitoring and cancer screenings are recommended for those on long-term immunosuppressive therapy. In summary, there is a link between immunosuppressants and an increased risk of certain cancers in lupus patients. However, this risk is influenced by various factors, including the specific medication used and individual patient characteristics. It is essential for patients to discuss their treatment options with healthcare providers, ensuring that they receive personalized care that considers both the benefits and potential risks.